You're watching Beyond Markets, where we bring you up to speed on development outcomes in Africa. I'm Kenneth Igbomor, and thank you so much for joining me on the show today. Coming up onto the show, we'll be looking at how Africa is bracing up to the COVID-19 pandemic. You can join the conversations on social media and let me know what you think. The hashtag to use is Beyond Markets. You can also hit me up at Kenneth Igbomor. Now, the Africa Center for Disease Control and Prevention is coming up with a new continental strategy to ramp up testing and help limit the transmission of the COVID-19 outbreak. The man leading the strategy today, Director of the Africa Center for Disease Control and Prevention, Dr. John Nkengasong. He joins me now to discuss this and more. Thank you so much for joining me on the show today, sir. Now, I'd like to understand this new strategy that is coming up for the Africa CDC.
Thank you, Kenneth, for having me on the show. The new strategy is we are tweaking our strategy as the pandemic evolves on the continent. And as you recall, when we launched the joint continental strategy, it was anchored on 3 pillars. One was to prevent transmission, secondly, to prevent death, and thirdly, to prevent harm. As part of that overall prevention of transmission and death approach, we now have launched, under the leadership of the chairperson of the African Union Commission, His Excellency Musa Faki Mohammed, a very succinct approach to increasing our testing, to ability to trace those who are positive and isolating their contacts and then providing treatment. So we're calling it Partnership to Accelerate COVID Testing in Africa. So what is the rationale behind this? As we speak today as a continent, we have tested or conducted about 2.5 million tests. And you have to put this in context. This is a continent of 55 member states with a population of 1.2 billion people. And so if you look at the 2.5 million we've tested and you divide that by the population there, it gives you about 1,600 people tested per million, which is extremely low if we have to be ahead of our curve. So I think that is the whole rationale behind this. If we increase our testing, we find the cases, we isolate them, and then trace their contacts. And that is how we are going to win this battle against COVID-19. So this is an important initiative that has 4 main goals. One is to increase that testing to about 10 to 20 million in the next 2 to 3 months. Second is to have a platform that will allow countries in Africa to go in there and shop, a kind of online shopping platform for commodities, including diagnostics. Thirdly, is to be able to catalyze and advocate for the deployment of about 1 million community health workers that will help in the tracing component of the PACT initiative. And lastly, the ability to train over 100,000 healthcare workers so that they can actually help in the community to manage those that will be infected and need care. So that is the overall initiative that still fits within a continental strategy, but it's an acceleration from that strategy to say, well, a pandemic is increasing. We are, as we speak, as a continent, we have recorded about 162,000 cases. Of that, that represents about 30% increase in new cases with respect to last week. So we are beginning to see that a pandemic is picking up, so we need to tweak our strategy in order to combat the virus effectively.
All right, talking about tweaking the strategy now, let's walk the talk now, because I'm trying to understand how it's going to play down to the nitty-gritty in how you're going to work with the countries or the regions and even back down to the communities. You know, how will this new strategy play out?
So, I listed the key components of the strategy. Let me start with the platform, because one of the challenges that we are facing as a continent is that even when countries have the money to buy the test kits, they don't have access to that. So I think what we've done as part of this initiative and under the leadership of President Cyril Ramaphosa, the President of South Africa, in his capacity as the President of the African Union, and working with special envoys, Mr. Strive Masiwa, they've actually engaged with several markets, including the markets in China, to have at least the availability of 15 million kits tests per month for the next 6 months. So I think that begins to address the problem of, well, if country X has the money to buy the test, can they get it? Yes, you can go to the platform as from next week and also to get it. So that is very, very practical, what we are doing or have done to unlock the supply chain management component of the commodities, not just diagnostics there. So that is one. Second thing is that by building the partnerships, we focus the initiative. We are saying that we have to unlock our economies, but we have to do that safely. And the way you do that safely is to increase your testing so that you know exactly where there's concentration of the virus and you focus your efforts there. I think that is going to be very central to our ability to cope and fight this virus effectively there. So precisely, what does that mean? It means groups, the partnership component of the initiative is so important. Just today, the MasterCard Foundation committed $39.2 million to supporting this initiative. The Canadian government has committed $2.5 million to supporting this initiative. So we are calling on the continent as a whole to rally so that they can support countries to get the right commodities, including the rapid scale-up of test kits to support this initiative there. So I think those are some very practical things that will happen because of this initiative. And lastly, just yesterday, we had the chairperson of the African Union Commission chaired a meeting between all 55 ministers of finance and 55 ministers of health to come together with the special envoys that President Ramaphosa has appointed to begin to work out a formula on how do we use monies that have been raised through debt relief and debt standpoints to support the response, which they need to do that. That is, they meaning the ministers of finance and ministers of health need to work together to begin to increase access to of the funding in a predictable way to support the PAC initiative.
Definitely, the collaboration there will definitely help to bolster things and how they play out. But I'm particular about improving testing outcomes. Yet we've seen some countries do quite well with the number of with the amount of tests that they're carrying out. But some countries are still lagging behind. You know, are there platforms in the Africa CDC for knowledge sharing on how to go about this, since we're dealing with a peculiar foe here?
Yeah, thank you, Kenneth. There's a platform that exists within the Africa CDC to share information. As you are probably aware, when we discussed previously, we stated clearly that the continent is organized at 3 levels. At the highest level is it's a strong coordination of head of states, headed by President Cyril Ramaphosa. And then you have coordinating committees of ministers of health, ministers of finance, and ministers of transport. Underneath that is a technical task force, what we call the African Coronavirus Task Force. And they have working groups there. So within that structure, every week, every Tuesday at 4 p.m. East African time, the entire continent comes through that platform to share knowledge, share information, share good best practices, and share country experiences there. Just last week, Egypt was on that platform to share their experiences. South Africa has been there, as well as Cameroon and many others there. So that is the unique platform that countries can come to every Tuesday at 4 p.m. East African time to learn and share information. Now, if you look at the guidance we are providing under the PAC initiative, there are specifics on what we are encouraging countries to do to increase their ability to test. That includes decentralization of testing, includes building partnerships with the private sector, includes strengthening your transport systems. That is, if the areas are so remote, we have a network that can bring the specimens to the central lab and do the testing and give the results back. So it's not just an initiative that is rolled out, but there are specifics of what countries can do to increase their testing.
All right, but I'd like to get into one that I'm quite passionate about, which is how we protect the frontline workers, because we know how critical they are, you know, to the success of any strategy that is going to be put in place. You know, recently Nigeria recorded just over 800 infected workers there. But I'd like to know, at the Africa CDC, what is being done to, you know, limit the impact on these key people who are, you know, leading the charge against this pandemic.
That's a very good question. If you, again, let me refer you back to our continental strategy, joint continental strategy. One arm of that strategy speaks about prevention harm and social harm and economic harm. The one harm that we are very concerned with is ability to protect our frontline workers. These are the people that protect us, and we have to make sure that they are protected. And the other part of the harm is that if we do not do this, what will happen to our healthcare system? Our healthcare systems may actually collapse if we do not really, in a very deliberate manner, develop and design approaches that will prevent our healthcare workers, which in the first place are limited. And if they get infected and they get hospitalized or died because of COVID infection, then you begin to imagine the impact that will happen to other programs like the HIV, TB, tuberculosis, malaria, and other immunization programs. So we are taking it very, very seriously. I mean, it has a huge potential to harm our healthcare system, including the ability to deliver adequate services there. So what are we recommending? We have developed very strong recommendations that says that commodities, supply chain, response commodities, that is personal protective equipment, commonly called PPEs, must be readily available at those facilities that are seeing patients. I mean, clearly, and there must be strong guidelines for that. So what have we done? We've trained over 39 countries on what we call infection prevention control measures. And since before this outbreak actually took hold on the continent, we started that. As a matter of fact, we were actually in Nigeria, working with the Nigeria Centers for Disease Control and Prevention, where we brought 39 countries back to back and to train them on infection prevention control measures when the first cases of the first case of COVID-19 was reported in Nigeria. So we had people on the ground, and we still have them on the ground in Nigeria because of what happened, that these first cases occurred in Nigeria or were reported in Nigeria when we have boots on the ground there. So we've trained over 39 countries on infection control prevention, and we hope that they can cascade this down. And we are very pleased with what the Nigeria CDC is doing with respect to cascading some of these trainings down to the more regional levels. So I think that's what we want to see happen across the entire continent.
All right, I need you to hold that thought for a second while we'll take a quick break. But definitely when we return, we'll look at how the easing of lockdowns would impact the work that you're doing. I've been speaking to Dr. John Nkengasong, the director of the Africa Center for Disease Control and Prevention. Welcome back to Beyond Markets. If you're just joining us, the director of the Africa Center for Disease Control and Prevention is my guest today on the show, and we've been assessing how Africa has been bracing up to the COVID-19 pandemic. Dr. John, before we left off, I wanted to get into another angle of this conversation. Now we're seeing how this has the pandemic has evolved so far. We're seeing countries now trying to ease the lockdowns, but I'm trying to understand how much this is going to affect the work that you're doing to try and prevent the spread of this virus.
So let me start with the acknowledgement that we are balancing between saving lives and saving livelihoods. And that's a challenge we all have in front of us. And it really calls for greater coordination and cooperation amongst everybody. And secondly, that it is a collective responsibility and accountability to make sure that we fight COVID-19 together. And with that will only be achieved if we exercise self-discipline and follow the public health measures that we are putting out there. And the second fact of this is that as we unlock our economies, we will see increase in cases. So what does that mean? We have developed guidelines and issued these guidelines that, or guidance that clearly advise countries or guide countries on what to do. So let's start with the things that must be done. So a couple of things. One is to intensify the public health measures. That is the PAC strategy we just roll out today, which is as you plan to unlock, you should make sure that we have enough testing capacity. We should be able to track those that are infected so that we can provide facilities for isolation and quarantine. We should be able to provide facilities to ensure that people who seek care can have the appropriate care so that hospitals are not overwhelmed. So those are things that you have to have in place to ensure that as you unlock your system, your public health systems are ready to meet the challenge there. The second thing we need to do after you have that is that you do that in a stepwise fashion. You just don't suddenly unlock the entire system, because it will completely undermine all the efforts that have been put in place over the last couple of months to prevent the spread of this virus. We have to acknowledge that the lockdowns were extremely valuable and critical in blunting the spread of the virus early on. I mean, there are countries that were reporting almost a doubling of the number of new cases before lockdown, and that number decreased to about 5% after a few weeks of lockdown. So that was a lot of return on investment there. We have to preserve this and make sure that the unlocking process is stepwise. So we look at the targeted population, make sure we really, begin to ease down the measures and then re-evaluate them after a couple of weeks to be sure that the measures, on easing is being conducted appropriately there. And then, of course, social distancing, wearing of masks, we reinforce all of that. So these are things we must do to accompany an appropriate on easing of these measures there. What must we not do? Let me just switch gears and discuss that for 1 second, is to be under the false impression that because we are on easing the stringent measures that were put in place a few months ago to prevent the infections, that the infections are away. No, we will see an increased number of new cases as we unlock our system, but there are certain things that we must not do. A couple of them include large gatherings. I think this is not the time for us to be having large gatherings like big celebrations, large worship gatherings, and large going to large soccer matches or social events. I think that would just provide an opportunity for the virus to spread more and more. I think we should be very careful and try to deny the virus the opportunity to spread by not organizing or offering such an opportunities to the virus to spread. I think those are some of the things that we must bear in mind as we think through the process of balancing between saving lives and saving livelihoods. Our number of deaths are increasing. I mean, just from last week to this week, the continent as a whole has reported an increase of about 25% new deaths. So I think we should have to take this virus seriously. It is a deadly virus. It is a deadly enemy that we must respect and not take it lightly.
Definitely, I hear you when you talk about it being a deadly virus and how serious it is, you know, but then when you look at the level of compliance we're seeing on social distancing and wearing a face mask, for some, the idea of social distancing is a luxury, you know, and how can we address some of this and change these attitudes and encourage people to, you know, partake the best practices in there. But then I also like to get into one other thing, because like you rightly mentioned about large gatherings. Now, for countries like Nigeria, now we're looking to open our airports very soon, later this month, and I'm trying to imagine how that will free up or that will also affect the work that you're doing when you see that large-scale movement of people, you know, from across different provinces.
We hope to release guidance next week on how to unlock airports and what are the behaviors that should be, how we should conduct ourselves when we go to the airports. I think we are very close to finalizing that. We are also very close to finalizing and issuing guidance on cross borders, because you just cannot unlock an airport, say in Abuja, and then you solve the problem. I mean, there must be another airport somewhere, maybe inside the country or outside the country, that is ready to receive a plane. So I think, we're developing a comprehensive guidance on what should be in place and what we should be doing with respect to conducting ourselves at the airport once we arrive, when we go through the registration, when we go through the check-ins, and when we are on board. So I think that is key. Again, it's a challenge and a battle between saving lives and saving livelihoods, and a challenge that we must deal with.
Still on this, we're trying to imagine the post-COVID world here, and yes, on one hand, this is a virus that has come and has, kind of changed the way we perceive and behave and act and, do things amongst ourselves. But then we still should not lose sight of the fact that we're just 10 years away from the deadline of the Sustainable Development Goals. And when you look at all the other health indices in there, how is Africa, what's Africa's progress, and what are we doing, especially on the front of containing disease?
So we are still very early in this pandemic, and as a continent, we are perhaps just 4.5 months into this pandemic. It seems like we've lived with it for about 4 or 5 years, but because of the intensity with which we are addressing this, and we also address this from the standpoint that it is a survivor issue. That is, it's a war we have to win to survive. But there are a couple of things that we must acknowledge, that the impact, the social and economic impact of this virus will be devastating. Absolutely no doubt about that. We also have to remember that the endemic diseases that we were faced with before COVID are still there. That is the HIV, the TB, the malaria programs, the immunization, and the non-communicable diseases are still there. So again, if we were going to be pushed back by several months or years in terms of missing our targets for the Sustainable Development Goals, it is a fair assumption to believe that because of COVID, that target might actually be missed by a significant number. Remember, the economy and the health is very, very related. If the economy is doing well, then there are enough resources to apply to healthcare programs, and if the economy doesn't do well, of course, there's limited amounts of resources to fund those programs. So there is absolutely no doubt, and I don't have any statistics yet for this to suggest that we will be missing some of those targets because of the effect of COVID-19. Clearly, we saw what happened in West Africa. There were many deaths that were due to Ebola, not necessarily because of Ebola, which means because Ebola challenged the health system that are required to deliver those outcomes, you naturally tend to lag behind that. So I don't expect that a virus that has spread extremely rapidly across across the entire continent and the world in less than 5 months, with a very high number of deaths, would not impact our ability to meet our Sustainable Development Goals.
Let's look at resource mobilization. Yes, there have been quite a lot of calls on funding of healthcare in Africa for years to come. I remember so many interviews we've had with health ministers talking about what they're doing for funding in healthcare. But then now I'd like to get specifically to the work that you're doing, on your level of resource mobilization we've seen on your front. And I'd like to know how the African Union's COVID-19 Response Fund is doing.
We are still very early on in a battle against COVID-19. But let me just say this, that there are already lessons that are emerging, and that as a continent, we will be more than happy to engage in a broader conversation as to what and how we actually address the challenges that we face as a continent with respect to strengthening our health system. It has to cease from being just a dialogue or a conversation to reality, okay? Because we've seen the devastation that disease outbreaks will cause. And again, these are not imaginary. I think COVID has taught us, number one, that we are much more connected than before. We knew we were interconnected, but we just didn't know how much interconnected we were. Second is that a COVID infection anywhere on the continent will continue to be a COVID infection everywhere on the continent, because this is a virus infection that can spread very easily. So if you clean up a COVID in Cameroon and then somebody flies in from the neighboring Chad with or vice versa, then you start all over there. So I think we have to keep that in mind, that it will impact even our continental free trade agreement and other things there. Now, with respect to the resource mobilization, at the AU, it has been an unprecedented effort that is coordinated at the highest level of the continent, as I've indicated, under the leadership of President Cyril Ramaphosa in his capacity as the president of the 8th African Union, and the African Union Commission chairperson, His Excellency Musa Faki Mohammed. So because of that tight coordination, I think there's been a lot of mobilization of resources. As you are probably aware, the Bureau of the Head of State launched what they're calling the African Union COVID Response Fund, and has received, I believe, pledges of to the tune of over 60 million already, and it's continuing every day. I think there's a big drive for the continent to keep contributing, including an ordinary citizen. If you we call it a change for change. So there's no change that is too small to have an impact in this fight against COVID-19. So we are really urging the continent to contribute to that fund, which will become a war chest to fight the infection on the continent. At a more bilateral level, I can say that we've received support from many friendly countries, from foundations that, the list will be too long to go through here, but I just want to use this media to recognize and acknowledge the strong support that we receive from within the African Union Commission, as well as outside of the African Union Commission, from bilateral relationships and from the foundations.
Thank you so much for your time. A pandemic is definitely a time where we need to see this level of global collaboration as we all come together to fight this same enemy. Thank you so much for your time. I always appreciate the comments that you share on our show. I've been speaking to Dr. John Nkengasong. He's the director of the Africa Center for Disease Control and Prevention. And that's it on Beyond Markets for today. And thank you so much for being a part of the show. Definitely quite an interesting one to digest there, talking about how COVID-19 pandemic is impacting Africa. Remember, you can watch all episodes of Beyond Markets on our platform, on our website. That's at cnbcafrica.com. You can also catch the show at 5 p.m. West Africa time daily, and definitely quite a lot to look out for on the channel. For me and the rest of the team, have a wonderful day.